Nicholas Rawson has gone from bad to worse.
And this is the area that we were concerned about here.
His lungs are stiff and refuse to open up. Doctors have put him on 100% oxygen.
In this film, we don't see it at all. We just see severe
it is
RDS.
a very severe RDS and it's a pretty significant disease.
RDS, respiratory distress syndrome, is not uncommon in premature babies, but some babies don't respond to treatment as well as others. That's when doctors get concerned.
He started grunting, and we thought he'd do okay.
And he just got worse and worse.
And he got worse.
Then he got intubated.
Correct.
Okay. Baby is currently on the respirator. He's getting good support for oxygenation. Throughout the night, we will support what baby needs. We'll make sure the blood pressure and heart and everything else is okay, and continue to give ventilator support.
We will hope that he will turn around, but tonight's going to be pretty touch and go for the next couple hours because he was so critical when he first got here.
Are we here promptly at 1 o'clock?
I believe so. 8 minutes to spare.
All right.
In a couple of hours, Yolanda and her husband will add a second set of twins to their growing family.
This is my daughter, Robin. And these are our other twins, Brian and Bobby. Just to kind of keep my focus and help me to remain calm and reduce my anxiety.
Yolanda's last two pregnancies were vaginal births. But because twin A is breech, she's been scheduled for a C-section.
Anything like seizures, migraines, epilepsy?
No.
With baby B severely growth restricted, almost half the size of his sister, doctors want to deliver Yolanda right away.
Okay.
Before her C-section, another ultrasound to make sure that baby A is still breech. But now, things have changed.
Yeah, they're both breech.
Are you serious?
They're like laying on top of each other. So here's A's head, and here's B's head. And there's one body here, and the other body here. And they are laying on top. A will lay on top of B.
It's as if both babies are coming in the world telling everybody to kiss their ass. So, we knew the one already had that attitude, and now it appears as if they both have taken on the attitude of, yeah. So, I have to have a C-section. That's the only way to go now.
You're doing great, honey. Just breathe.
Just breathe. Does that work? Ow.
Carla Miller's day has been a series of cervical checks and blood tests.
We just checked Carla's sugar one more time. 86, just on the mark. Just what we want. Perfect.
It's too old for this. My body can't handle it.
You're going to be fine.
Finally, she hits a critical point in her labor.
Carla is up to 5 centimeters. I think she's halfway done. So we should expect more rapid changes at this point. I don't think it's going to take all day now.
It's a good sign, especially for a mother with gestational diabetes.
Diabetic mother could have a quite large baby who would have then problem being born because of its size.
Carla was induced today at 37 weeks for that very reason, so her baby wouldn't get larger.
Worst case scenario for big babies that it will stop coming down. It won't come down any lower, and then the doctor will have to do a C-section.
The other problem is these big babies in particular are at risk for stillbirth. They're at risk for dying before delivery.
2 hours later, Carla's baby starts showing signs of stress.
Baby's heart rate's having some decelerations. From the looks of it, they look like the kind of decelerations we see when there's some pressure on the cord. So here's where we see the baby's heart rate dropping with a contraction. Here's another one that's typical.
To take pressure off the cord, Carla's doctor stops her Pitocin, the medication used to induce labor, but that in itself can cause problems.
Our goal here is to get this baby delivered. If she doesn't get Pitocin, she doesn't have contractions. If she doesn't have contractions, the baby is not going to get delivered. Now, if the baby can't tolerate labor, the baby has to be delivered by cesarean. But the only way we'll know if the baby can't tolerate labor is by producing labor.
With a portrait of her 3 other children to focus on, Yolanda prepares for her first C-section.
Okay, we're opening up peritoneal cavity now.
A few hours ago, she learned that not one, but both of her babies were breech.
Tissue forceps smooth ×2.
A C-section was the only option.
Okay. Rotate the other way.
At 4:11 p.m., Cameron makes her debut.
Here's the first one. Here she is.
She's big for 36 weeks, 5 pounds, 12 ounces.
Here's the little boy.
A minute later, she's joined by her brother Kyle,
Here he is.
who at 3 pounds, 11 ounces, is almost half her size.
Oh, they're going together.
He's having a little difficulty breathing. He's pink. His color's good, and he's fairly active. But he has small heart murmur, and he's just too small to stay in the well baby nursery, so he'll come to intensive care. You have to take a trip to the children's hospital, huh?
And say hello to your son. He's going over to the neonatal intensive care area. He's fine right now, okay? Congratulations to the both of you. All right? Questions before we go? No. All right.
80 on rest and 36 to rectal.
Surprisingly, Kyle's newborn evaluation scores are higher than Cameron's.
And he's a whole lot smaller than his sister. But his APGARs were better than hers.
Kyle is breathing on his own. Meanwhile, his sister needs help.
You would have expected the male twin to be more prone to respiratory distress, but Mother Nature has other ideas, other days, and all we can do is react to them.
But soon, these twins will change position once again.